Coming up today, she didn't qualify for a lung cancer screening, but she wanted one anyway. And thank goodness she got one, because that proactive decision helped increase her odds of survival. Good morning, I'm Alexis Del Cid. Welcome to the Morning Medical Update. Lung cancer remains the leading cause of cancer death in the United States and in the world. That's due in a large part to cigarettes, although non-smokers can also get lung cancer. Either way, early detection can lead to better outcomes. And there is a way to screen for lung cancer. The woman we're meeting today says she's alive because she pushed for that screening. Amy Hart-Doring joins us in the studio right now. And Amy, because of that screening, your cancer was caught at a very early stage, stage 1A.
Yes.
We're going to get into that in a moment. We're so glad you're here with us. And we're also joined by your thoracic surgeon, Dr. Ali Khan Naji. Dr. Naji was not only Amy's thoracic surgeon, he's also the medical director of the lung cancer screening program here at the University of Kansas Health System. Know you're a busy guy, so thank you for making time to join us today so we can share Amy's journey with our viewers. Amy, you had just turned 55. What prompted you to want this screening? Were you having any symptoms?
No, I was having zero symptoms. I just turned 55 and wanted to make sure that all my ducks were in a row. And I had smoked in college a little bit in and out of my 20s, and just thought it would be a good idea. So, and my doctor agreed, so we did it.
So you turned 55, so we're talking more than 30 years ago. You smoked in and out during your college years.
Yeah, in and out of my college years, and then socially off and on, but nothing, you know, like you would think of a traditional smoker.
5 packs a day or something like that. Your primary care doctor suggested 2 tests. Your doctor suggested a chest CT and a cardiocalcium CT. We actually have some cool video of someone getting the low-dose chest CT scan, and you can see the man laying down in the machine, puts his hands above his head, and they just roll him into that tube where he's asked to hold his breath for a few seconds, and then that's about it. Looks familiar to you. How long are you in that tube?
Not very long. Not very long at all. As a matter of fact, I think it was maybe less than a minute, maybe 2 minutes. It wasn't very long at all.
You didn't meet the requirements for your insurance to be able to cover this scan, so you paid out of pocket for this scan. May we ask how much it cost?
Yeah, it was $136 for both tests.
$136 for both tests? I was expecting you to say a much higher number without insurance.
I actually was as well.
So you were probably delighted.
I was delighted, yeah.
$6,000.
Yeah, exactly, exactly.
Because when I first heard about your story, I thought, gosh, she paid out of pocket. That must have still been thousands of dollars. Because you never know. It's always frightening to see the bill come in and see what it would have been if you didn't have insurance.
Yeah.
I want to go over the criteria that make you eligible for a screening that would make it possible for insurance to cover. So the typical guidelines say you have to be between ages 50 and 80, you have to be a current smoker, or you have to have quit within the past 15 years. And then this is the real kicker: to qualify, you must have been a smoker who smoked at least a pack a day for 20 years. You didn't meet you only met the age requirement, really.
Correct, yeah.
Wow, so how much did you smoke typically? Was it ever a daily thing?
Never really a daily thing. In college, probably, but that was a long time ago. So, and as an adult, it really was just hanging out with friends, having a couple drinks, socially. So social smoker.
And that was it.
Yeah.
Dr. Naji, there's a term called pack years. What are pack years?
So pack years is just a way for us to quantify the amount of cigarettes someone has smoked over the course of a lifetime. Essentially, what we start out with is if you smoke 1 pack per day, per year, it's a 1 pack year. So 2 packs per day for 1 year is 2 packs. It's a 2 pack year.
Wow.
And if you say a half pack per day for 20 years, it's 10 pack years. So it's just a simple kind of math formula that helps us kind of get an idea of how much smoke someone has truly taken in over the course of their lifetime.
Are you able to track pack years for people who are servers in places where people are smoking? How do you
No, that's difficult.
that?
You can't qualify secondhand pack year.
Right.
Right. So this is pretty much somebody who smokes primarily.
It has to be direct. when we talk about the cost, yes, $150 is less than you would expect something to cost, but it's still a lot of money for a lot of people. What if Amy couldn't have afforded that? What would have happened?
You know, it's difficult to say. I think in this day and age, is you want to be an advocate for your health. Now, remember, it was $136 for both of her scans. And if I, kind of speaking off cuff here, I think the cardiac calcium score scan, I believe, is only $52.
Yeah.
So the remaining cost of that, the remaining $80, I believe, is the lung cancer screening. I think somebody who's, you know, it's the one thing that it's whether you're invested in your health or not, right? We make those choices every day, whether we're going to buy that extra latte or we're not going to buy the extra latte. Right. So should we save our money and get a scan? Maybe that might be the thing. But again, if you qualify, there's an opportunity there for CMS and your insurance to pay for this.
And if your insurance doesn't pay for it, can anyone just call up and go ahead and get a scan for their peace of mind? Would you recommend that?
I can't say that I recommend that because that's not within our guidelines. So from our guideline standpoint, no, we would follow the CMS guidelines that are put out for our lung cancer screening. However, if somebody is concerned and they do want that peace of mind, then if you have the means, by all means, go for it.
Go for it. Your cardio score turned out clean, your
0.
cardiac
Yeah,
CT. Yeah,
exactly.
So it was just the lungs.
It's just the lungs.
What did the doctor or radiologist say to you after they saw your lungs? What did they see?
So it was my GP that called with the report, and then of course I was able to log on with my chart and get it.
Oh yeah, you get it before.
Correct, yes,
yeah,
which is almost a little scary.
Yes.
And then of course I became a Google doctor before I met with a pulmonologist because I was researching everything I could get my hands on. But what it had said in the original report was that it was an 8-millimeter nodule that was mildly spiculated. And I think the mildly spiculated terminology got my GP
what does that mean?
to give me a call and say, hey, let's go see a pulmonologist. I believe, again, I'm a Google doctor. Dr. Naji can probably speak
Let's
to
just
this.
see what you learned from Google, then we'll ask
Yeah.
Dr. Naji.
Anytime it says spiculated, that is a red flag, and you should at least go in and speak with someone who isn't a Google doctor
What does speculated
about it.
mean?
Well, spiculated, so if you can imagine, if you have something spherical and round, it's fairly smooth edges, right? So spiculated just means it may have some spikes or things that make it look irregular on a scan.
Oh, like when they're looking for skin cancer and they look for irregular things?
Similar, but
Yeah.
when you know, we'll have an opportunity to see Ms. Hart-Daring's scans here in a little bit, and we can kind of point that out. But in essence, it's not perfectly round.
Right, and we will get to those in a minute. First, I want to share a really nice picture. This is nothing about your lungs. This is a picture that makes me happy to see. Who are these people in the picture with you?
So that is my husband and my 3 adult children. Yeah.
How do you break the news to your husband and your kids that you have lung cancer?
It was not easy. I think first there's a terrible stigma about lung cancer. So immediately when I felt for me that this was my fault and that I could have proactively prevented this if I had done and made better choices. So to tell them, hey, I have lung cancer and here's the process we're about to go down, I think it was a little bit of guilt for being a mom of 3 and having made, bad choices as a
college kid.
a college student or
who
even in
doesn't
my
make
20s. Yeah.
bad choices as a college kid from time to time.
So
or in their
it was
20s.
really tough, but the kids were great. My husband was fantastic. I had a fantastic support group. My mother-in-law actually survived lung cancer, and she's
Wow.
84, and so she was terrific. She was
She
absolutely
was able
terrific.
to say, "Look at me."
Yeah, and my sister-in-laws and we all just rallied around. They were terrific. It was really good. Very lucky.
I want to ask you about the stigma, the lung cancer stigma, and I was going to ask this a little bit later in the discussion, but since you brought it up, when I was preparing for this program, I kept seeing that term in medical journals and reports. Lung cancer stigma is a real thing. It's so real that there are articles written about it.
Correct.
Did you feel the stigma, or was that something that you were just thinking in your own mind?
I think I might have created it in my own mind a little bit. But also, too, I think that there is a lot. I mean, you don't see a lot of smokers anymore. Everybody knows it's bad for you. And if you're still smoking and you don't think it's bad for you, you must be living under a rock. because it's everywhere. It's in the media. It's, you know, even on a pack of cigarettes, I think they have labels now that say, you know, this could kill you.
Right.
So there is a stigma about it. I think that the Lung Association did a really cool media campaign about it. I think Valerie Bertinelli helped them out with that and tried to make it not be such a stigma and to get people to do their scans and not think terribly and with guilt and whatever if they did have it. So,
what do you see in your profession when it comes to lung cancer stigma?
I think there is a stigma, partly because when we look at the cancers that are prevalent, that get a lot of the media attention, breast cancer, prostate cancer, colon cancer, a lot of these are almost what we believe to be no-fault cancers, right? You didn't do anything to deserve this, the patient didn't do anything to deserve it, but yet with lung cancer, well, you smoked, right? There, like you said, there's a warning on a packet that says don't do this. There's news, there's articles, there's this, there's that. But what we understand is that what it really boils down to is we have something in front of us, we need to treat it, and everybody's a human being, and we treat them with compassion, we treat them with kindness. But yes, there is that, and that is something that's difficult both for the patients, from a research perspective, from surgery. It just, all in all, everybody's like, well, they did this. And I was like, well, it's done, but we'll take care of it. Yeah.
Yes, did, and now you're going to fix it.
Right.
How long did you go to Dr. Google before you finally cut yourself off? Did you cut yourself off, or were you still whipping yourself into a frenzy? Oh no.
No, I'm kidding. Probably after I saw Dr. Najee, I laid off the Google Doc.
How often does someone come to you having not Googled what they have first?
In this day and age, it's pretty rare.
Is that frustrating as a doctor to have to undo that?
No, I don't think it's frustrating, because I think that the important thing is you understand that the patient's coming to you for guidance, but that they've also sought and tried to advocate for themselves, right? So that they obviously care about what they have. So they've Googled it.
Right.
So if we take that attitude towards something, then we know that we're coming into it with the shared decision making of, yes, let's dispel any myths you may have heard, let's reinforce the good things, and let's come up with a plan together, right? We just have to meet our patients where they're at and go from there.
When people Google, and I'm sure when you Googled lung cancer, you read survival rates, it's never reassuring. How do you reassure people that actually there are people like you had your mother-in-law, thank goodness, who's walking and living, and she's a healthy 80-year-old woman.
Yeah.
Sorry for telling your mother-in-law's age.
I know, right?
But she's healthy and happy. How do you make sure that people still have hope with these treatments that you offer?
I think the most important thing is that you can't tell something just based on a scan. I always tell them we can't tell anything until we put it in a bucket and we look at it underneath the microscope. Once we have that, we'll have better ideas and answers that we can provide. So to jump to conclusions, as we are prone to do as human beings, is difficult to say, and it's difficult not to do.
Right.
But the idea is that not everybody's created equal. Not every tumor is created equal, I should say. And that we need to take it one step at a time. So let's see where things go.
And in Amy's case, it required several steps. Before you met Dr. Najee, you had a series of scans and tests. You had, let's go through this. They put a scope down your lung, you had another scan, then a lung function test, then a PET scan, which is a lot of stuff. Was that all crammed into a short period of time?
Yes, actually it was. And I think what it is, and Dr. Najee explained to me, in order for him to be able to move forward with me as a patient and kind of diagnose, correct me if I'm wrong, I needed to make sure that I had all the tests in place so that he could look at everything and then decide what was the best course of action. So I tried to really advocate for myself, and the KU person that helped me book all of my appointments and everything was fantastic. So
you had a nurse navigator.
Yes,
probably.
the nurse navigator. Thank you very much.
Our nurse navigators.
Yeah, she was fantastic.
We have some really cool images. Well, they're cool because they're images you don't usually see. They're upsetting because you weren't seeing what you wanted to see. But let's talk through these images of Amy's scans. What are we looking at? Go from left to right.
So first off, this is her lung cancer screening scan, which was her first scan that she actually did when she paid out of pocket. And what we can see here is these are three different views of her lung fields. So starting on the left side is just what we call a sagittal view, and so we're looking at the left chest. In the middle is the coronal view, so on the left side of the screen, on the left part of that middle image, you'll see the right lung, and on the right side is the left lung, so it's flipped. And on the right side is your axial view, and again, it's flipped. So your right side's on your left and your left side's on your right, so it's a little confusing.
Can we see the cancer in
You
these
can
images?
actually. If you look closely on the left side, on the left lung, so the right side, in the middle picture, you'll see a more of a solid-looking, tiny little. I can't point to it. I'm sorry,
Yeah.
but kind of like half, like towards the bottom, near the curved diaphragm,
I see it.
and near the spine,
yeah.
you'll see a little.
Like a white
abnormality,
little
yep.
white blob.
That's her cancer.
And that was stage 1A. Is it possible?
so-
Oh, here's a couple more.
And that's
Yeah.
her diagnostic CT. So a low-dose screening scan, it provides good imaging, but it's not great imaging. The cuts aren't as thin, so we get a more diagnostic CT, and this is a diagnostic CT, and you can see the nodule itself is a little bit more well-defined, and we have a better idea of its location.
Was it located in an airway?
No,
Or
in the left lower
Just
lobe,
in
the
the
lung.
just the lobe, just sitting there. Is that good or bad when it's in that location?
Kind of indifferent. in that
Doesn't
regard.
matter
Doesn't
where,
really
where
matter.
it is. Now here we have some.
And this is a PET
Cool.
scan, and the PET scan, the way it works is it gives you a glucose molecule that goes throughout your body, and any cells that are hyperactive, your brain, your heart, your kidneys, tumors, and infection light up. So you can see that there's a faint lighting up of her tumor on the left side.
On the left side, okay. That's super interesting. It was stage 1A. Is it ever possible to see or diagnose a lung cancer before it's 1A? Can you see it starting to
So not
grow?
really. So a CT scan, you'll basically you can see things, smaller, 2 to 4 millimeters in size, but you really don't know what they are. You really track the rate of growth. In a PET scan, usually a tumor needs to be about 1 centimeter in size for it to actually have any type of activity. So everything's a little different. That's why when we look at those scans, we want to have an idea of what we're looking at before we make those surgical decisions.
If Amy had waited until she had symptoms, what stage would the cancer have? What stage is the cancer at by the time you have symptoms?
So very far gone, probably.
Yeah.
Yeah, there's no great way to put that.
Yeah.
If you're having symptoms from your lung cancer, unless the lung cancer is located specifically within an airway, it's not very good.
So thank goodness you were proactive, and thank goodness it was accessible
Yeah, most definitely.
for someone to get.
I believe my last scan before the surgery or after this, I think it went from 8 millimeters to almost a little over 1 centimeter, I think,
I
and
believe
that's 60 days.
I believe the final
Oh.
pathology was about 1.4 centimeters in
Yeah,
size.
so it almost
it-
doubled in size in
was-
60 days.
Is
Yeah.
that a fast growing
Yes,
cancer
but I mean,
then?
I think in looking back, I don't know if the initial 8 millimeter was a true measurement.
Ah, okay.
So
Sure, that's true.
There are different types of lung cancer. Amy's was called adenocarcinoma. What's adenocarcinoma?
so adenocarcinoma.
Adeno, thank
No
you.
problem.
That's
Is
why
it-
you're the doctor,
Yeah,
and I'm.
That's why they pay me, right? I guess.
Yeah.
And that's why I went to that doctor school, the non-doctor Google school. No, but adenocarcinoma is a form of non-small cell lung cancer. So there are
Okay.
2 major types of non-small cell lung cancer: adenocarcinoma and squamous cell. Now, most of the people out there worry about something called small cell lung cancer, right? That's the one that if you hear and you doctor Google that one, those are the ones that you just are very afraid of, and you have just that sinking, horrible
Oh,
feeling, right?
okay.
We have non-small cell lung cancer, and that's adenocarcinoma, and those are more closely associated with smoking. Everybody's every tumor has its own biology. So even though they're adenocarcinomas, not all adenocarcinomas are the same. So that's why we look at things, and we did something called a risk reveal for yours. So we look at different tumor biologies for each of these things.
From your perspective as a surgeon, does it affect the kind of surgery you do?
Not necessarily, no. Location, size, stage, there are a lot of other factors that do affect what I can do or what I can't do. But in her situation, it was pretty much this is what we're going to do,
Cut and dry. And how do you get to the cancer?
very carefully.
Do you open her up, or do you go through another way, a bypass way?
So Amy actually underwent robotic thoracoscopic surgery. So essentially we use the Da Vinci intuitive robot, and she has 5 incisions less than 1 centimeter. We make one a little bit bigger at the end, and we're able to remove her lung cancer.
Guided robotic, and we're going to get to more on that in a little bit. I do want to ask Amy, you've said in past conversations that you now make 90% healthy choices. What does that look like? And that's very honest, because if you say you make 100% healthy choices, you're fibbing.
Right, exactly.
What does it look like to make 90% healthy choices?
Well, I think I kind of have always done that. That's why this was such a shocker to have. I do yoga. I teach yoga. I've been practicing yoga forever, for over 25 years. I'm an ex-runner. I walk every day, 4 or 5 miles a day. I try and make healthy choices. Not always. I love ice cream. So whenever I can, I will have, a scoop of ice cream in lieu of, a proper dinner when my husband's traveling. So I would say I make pretty good choices throughout my life, and it's hopefully, knock on wood, it'll pay off.
Well, it's probably helped with your recovery.
Yeah. Oh, exactly.
Your healthy lifestyle and nutrition.
Exactly.
I
Yeah.
believe the ice cream for dinner is called girl dinner.
Yeah,
if you're
exactly.
on TikTok, girl
Yeah.
dinner.
Yeah.
You wouldn't know, Dr. Najee, but it's like a plate of olives, cracker, cheese, and ice cream, and that's our dinner.
Yeah.
Our husbands
Doesn't
would
sound
not.
bad.
Husbands aren't happy with
Yeah.
it though. If we serve it.
Yeah.
We have questions coming in already. We have lots of people who want to get in on this conversation. So use the chat on YouTube, Facebook, or you can email us at the Medical News Network. All that information is right there on your screen. And we do want to talk about this robotic-assisted thoracic surgery, RATS. Do you guys call it RATS?
We do not.
Okay,
No.
because it had rats in quotes.
Right. No, we try to avoid that. It doesn't have the greatest,
Right, rats.
greatest selling
You don't want to
point
hear
there.
your doctor saying
Yeah,
that.
unless it's a Pixar movie, Ratatouille.
Yeah.
We're gonna do that. No, but it's just robotic-assisted thoracoscopic surgery. It's a technology that's been around for a little bit, not too old, but not too new either. We started the program here at the University of Kansas Health System. I started it back in 2017, so we've been doing it here for a period of time. We do about, last year we did almost 100 anatomic lung resections using robotic thoracic surgery. The recovery process is much better. The visualization, Amy was in the hospital for 2 nights. That's usually our normal hospital stay. And you have a tube in your side when you're done. We get it out and you get to go home. It's about 2 to 4 weeks of recovery, still uncomfortable. And there is pain associated with that, but we do provide a nerve block during the operation that helps kind of alleviate the pain immediately, but then we give pain medication control. We try to limit the amount of narcotics somebody would get.
Where are you in the heart during
I'm operating. I'm using the robot.
So you're, because
I'm at a console.
Okay, are you at a console across the room? Like I've seen cardio
Yes.
heart procedures done where someone is standing there and they're operating it and the patient's over there. Is that what it's like?
Similar, yes.
Okay.
Yeah, so the patient is on a table and I'm at a console a few feet away.
Wild.
Yeah.
Did you train for this in medical school?
No. When I was in medical school, this did not really exist. When I was in training, we didn't even do this in training. So when I started here in 2015, I actually learned how to do this and trained myself. And then now,
And look at you now.
I'm able to provide that for our patient population.
It's incredible to see the advances that we have in medicine and procedures. How did you feel going into surgery that day? And then how quickly were you able to get back to your life, get back to doing the things you love?
So going into the surgery, I was petrified. I had actually watched a robotic-assisted thoracic surgery video.
On Google?
No, I believe it. There's on KU.
YouTube?
Yeah, KU has one, a
The
link
health
to
system
it.
has, yeah.
And I watched that, and then I was completely like, my doctor's amazing. But it was, I was very scared,
Yeah.
but I was also relieved that this was going to happen and that I would be okay. And the staff was great. I mean, I told Dr. Najee, I don't even know how many times, how terrific everybody was, from the anesthesiologist to the nurse prepping me to them rolling me out. And it was like a team that all they cared about was me, even though I know that that's impossible because that's just what they do every day. It really made me feel like I was going to be okay.
You felt like you were the only patient.
I really, truly did.
Which
I
is-
really did. And it really was so neat to feel like everybody's on my team. So it
Yes.
was really cool. And even that was after the surgery, all the nurses and the doctors that came in and Dr. Najee's staff. And I was so lucky to have gone through this with KU.
Boy, that's
For
nice
sure.
to hear. You also had some support at home, and you shared the sweetest picture.
Oh yeah,
Who
one
are
of my
those?
kids, yeah.
Yeah.
They made sure that I got up straight away and started walking.
Is that what you're supposed to do?
Yeah. Dr.
Okay.
Naji actually has you up and going.
How soon after the surgery?
Day of.
Yeah.
Day of?
Yeah, day of, I was walking to the nurse's station and back.
So you wake up from surgery, and how many hours later you have her walking, doing laps?
Give it a few hours.
Wow.
Yeah.
Okay.
It was that
okay.
day, yeah.
That's great, and that's important to get the lungs.
Definitely,
Going.
we've removed a portion of our lungs, and deep breathing, coughing, exercise, moving forward is definitely an important part of your recovery. Definitely easier for some people than others. Amy did come into the operation in a healthier state
Sure.
overall than some of our patients, so it was easier. But still, we do want them to move.
You also have shared some pictures of things you've done since your surgery, which are such great pictures. You shared a picture of you with some people at a party. Mm-hmm. What are you doing here?
So this is just a girls' outdoor party we were having locally here in KC.
Those your besties?
Those are my very dear friends. As a matter of
Yeah.
fact, the gal on the right is my daughter's best friend. 'Cause my daughter was away at the time. And then those are my two really dear girlfriends.
Like
here
your
in KC.
surrogate daughter you had
Yes,
with you, your
exactly,
daughter's best friend.
exactly.
And then you enjoyed a trip to Nashville, and you got that perfect snap with the wings.
Yes,
Love
yeah,
that
yeah.
picture.
So I wasn't able to fly. So my husband and my daughter, I took a little weekend trip to Nashville. And we ran across Taylor Swift's Butterfly Wings. So.
Love that. And how soon till you could fly?
8 weeks.
6 to 8 weeks.
Okay. And your surgery was how many weeks ago?
Post-op 10 weeks Wednesday.
Okay, so you can fly now.
Yeah. Yeah, I've already actually had my first flight. So.
Oh, nice.
Yeah.
Okay. I want to go to some questions from our viewers because we have some good ones that people have emailed into us. Stuart wants to know, if I quit smoking 20 years ago, does that somehow lower my risk?
So there is a thought that the longer you are away from your smoking history, the risk of you developing lung cancer is potentially smaller. If you haven't developed it yet. Although yes, what that number is, how that quantifies, we're not exactly sure. And again, it also depends on how much you smoked those 20 years previous, right? If it was something very light, maybe we're doing fine. But then again, we've just proven that that doesn't necessarily hold water.
Right.
So I think that it might behoove somebody, if they're worried, to be an advocate for yourself.
Just like Amy. Jim wants to know, do the lungs naturally repair themselves after you quit?
I don't think that the repairing is the right word to say. I think that lungs, when they get damaged, they stay damaged. And fortunately, it's not like the liver that kind of regenerates. I think that what you could do is maybe slow the progression of damage more so than reverse the progression of damage.
When people stop smoking, they typically start coughing stuff up. So are you getting rid of all the stuff that's just been coated on your lungs that whole time?
That's not necessarily what that is. Essentially, what's happening is that your body has all this reactive mucosa from the smoking that's been suppressed, and so you're coughing all of that up. You're
okay.
not shedding the bad things, if you will.
Amy has a question. Amy wants to know, does it ever make sense to do chemo or immunotherapy to shrink the tumor before the lung surgery?
That is possible. It all depends on the size of the tumor, the location of the tumor, and the pathology of the tumor. So sometimes we do incorporate that into our practice. And again, that's why having those scans and visiting with the patient ahead of time to make that shared decision is important.
Denise wants to know, is it possible to have lung cancer and not show any symptoms? Well, yes. You didn't have any symptoms. So it is possible, which is why it's so incredible, what an incredible example you are that you were an advocate for your own health. I want to wrap up this discussion and get some final thoughts from both of you. Dr. Naji, what do you want people who are watching to know?
Advocate for yourself. I think that it's important that you take care of your health, but you understand what that means for you. Don't be afraid to Dr. Google something if you're worried. Seek out advice, seek out care, and we're here for you at KU.
Amy, what would be your message to our viewers?
Get a CT scan. If you, I think, turn 50 and don't mind paying $80, it's worth it for peace of mind, if nothing else. But I'm here to say I'm absolutely 100% shocked that I had lung cancer. And I would never have known it had I not had that CT scan. So go get one.
Boy, that's a good message. Thank you, and thank you for sharing your journey, and thank you for taking time to join us on the program today. Thank you to our guests for watching and joining the conversation. We will see you right back here tomorrow morning at 8.
Coming up tomorrow on the Morning Medical Update, life-saving liver transplants closer to home. I'm Jessica Lovell on the next Morning Medical Update. Meet a man who had to fly hundreds of miles to donate part of his liver, and learn how and why to become a living liver donor without making the same journey. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.